Thanks to our correspondent, Albert Sori, for bringing this story to our attention and telling it the way that he has. Let's turn our attention to Zoom on the back of what you've heard and followed. Roger Tambere is the executive director of Load Ghana. We saw him in this short documentary. Dr. Eugene Dodo is consultant addiction, psychiatric substance addiction expert, and he also joins us. So good morning to you both, gentlemen.
Mama May.
Yes, hi.
Long time.
Yes, Dr. Dodoy. I hope all is well.
Very well, by God's grace.
We thank God. I am very well, thank you. I want to start with Roger. And Roger, thank you. Thank you for turning your own situation around and using that to help others as well. So
you're welcome.
Great. Back to your own personal story. How long did it take you to recover fully?
Good morning to our viewers. It was a struggle. It's not easy quitting addiction. Earlier, the family didn't know that this was addiction. So they attributed everything to witchcraft, spiritual issues, and other things. So they were taking me to prayer camps, traditionalists seeking for help. But eventually, an expert, a psychiatric nurse, recommended that they take me to a rehabilitation center, and I was taken to Ankafo Psychiatric Hospital under the supervision of Dr. K. Sego, a clinical psychologist. So I did my rehab program at Ankafo Psychiatric Center. But I struggled more than 5 years and eventually went to rehab. And in rehab, I did 6 months and came out. I went 2011 and came out 2012.
Was it easy, you know, the way that you say it as you're recalling?
It is not easy financially, physically, psychologically. It affects virtually every part of the human being. Bring division to family. It wasn't easy at all. It wasn't easy. It's not easy quitting addiction, but you must do it. You must do it. You should fight for it. You need to come back and contribute to your quota to the development of society. It's not easy, but you must. We need it, and we need the support of our family, church, friends, and the country as well. It's not easy, but we must do it.
How was your life disrupted?
Badly. I think I would not say I'm intelligent, but I'm not also stupid. I'm not a bad student. I had Division 1. We were the last batch of the old system. I went to Roman Secondary School for my A-levels. I didn't do bad at all, but eventually alcohol would take your attention out of everything. So I started struggling when I was in the University of Professional Studies. Deferred my course and went for rehabilitation. It affected me. Every part of you would be affected. You find out that your friends are ahead of you, things that you wanted to do, things that you were doing, you just forget about them and concentrate on your drug usage.
Dr. Dodoy, we talk about the hard substance, but I guess that we hardly publicly talk about alcoholism, which is also a disorder, a chronic disease, if you like. How important is what Roger is doing, using his own experience and setting up the Load Ghana, a center where others can also come through and recover?
Thank you for having me. I must say what Roger is doing is super commendable. And that is what we'll be grateful to have almost everyone do for us. If people who go through the 12-step therapy, which he has mentioned, the 12-step, in fact, says that you would also reach out to other suffering addicts to come into recovery. So what he's doing now is the 12th step of the 12 steps recovery process. The first step is to admit that you have a problem and you are powerless over it. So if you look at admitting you have a problem to the level where you kind of more or less give back society to help other people who are recovering to come back. I mean, that is what he is doing now. But he enumerated the challenges. The financial challenge is one big step, because it's very expensive to be in rehabilitation anywhere in the world. Because don't forget that addiction affects people who are usually be in the working class. It starts in the teenage, but its impact is felt most when we are at the age of working. At that time, you have to stop work, leave work, go and stay somewhere for many months to a year or two to get recovery. Somebody has to pay for you. So at this point, you are not working. You are not productive. Somebody has to be productive and pay for your recovery. And it's not like once you go into rehab, you are by all means going to get recovery or stay sober. And just like any chronic disease we have, if you have hypertension and you get one heart attack, it does not mean you cannot get another heart attack. So some of them may get back into using the alcohol or drugs again. But it is part of the disease process. We didn't stop using the term relapse for them. He used it, but it's not a relapse. When somebody with hypertension gets his disease back or the BP becomes uncontrolled, we don't say they have relapsed. It is the disease nature. It was because formerly we didn't think it was a disease. It was more like a moral issue. And that was why that word was being used as if it was their wish. But the challenge is that addiction is a disease. And the most common drug of abuse is alcohol. So we know very well that the ones we abuse are the illicit ones, which is alcohol and tobacco. And in fact, alcohol causes more harm and damage than cocaine and heroin and marijuana all put together.
Yeah.
Alcohol more damage than all the three, which are all illegal. So it's kind of dangerous to turn away from alcohol. So for us in addiction, the disease is addiction. What you are addicted to is the symptom of your addiction.
Okay.
So people can get addicted to alcohol or to marijuana or to cocaine or to heroin or to prescription drugs now, the tramadol and the pethidine and the codeine, which are being abused now. Those are the symptoms of their condition. But the challenge is that they have impaired control. Their brains cannot handle a drug that make them feel high or change the way they feel, think, or behave. Once any drug does that to them, they always want to go back for the substance.
Okay, so
everybody who drinks alcohol, it has disease addiction. But some people who drink alcohol will get the addiction. And for them, when they get it, let's realize and treat them. There's treatment, like any chronic disease, and let's recognize and treat them.
Okay, so Dr. Dodo, you know, we drink once in a while. There are people who say they are occasional drinkers. At what point do you determine that somebody is addicted to alcohol?
Yeah, so somebody says it's an occasional drinker, except that the occasion comes frequently. So there are things we look up for in diagnosing addiction. Largely, we'll look at if you realize that the amount you intend to drink, like today is Friday, I want to drink 1 bottle of a stout like Guinness or beer, and I end up drinking 3 bottles, then I have a problem. If I decide that, oh, today with my friends, I'll spend an hour there before going home, and I end up spending 3 hours, then I have a problem. If I decide that, oh, I'll go there, and the time I use to recover from the drug, because if you get drunk and you have to walk home, if you're very drunk, you sleep there. If you realize that you are not able to go and get back the time you had intended to, then you know you have impaired control. Your mind cannot control the drug. The next one is craving. If you have this strong urge and desire every time to go and use the substance, then you have a problem. And then there is one nice way which I use what the patient told me to put it. I said, Doc, when you walk in front of the drinking spot, as if something pulls you inside. So there's what we call a compulsion. You feel compelled to drink or to use the drug. Then you have a problem. If you've been told that you have a medical condition because of your drinking, if you are aware that, Jeff was telling us that he had to drop out of school because of drugs. If you have a social problem, a legal problem, a medical problem because of the drug or alcohol you are using, and you continue to use it, then that's called continued use despite harm. So when you have any of these 4 C's, we call them usually. So impaired control, craving for the substance, compulsion to use the substance, and continued use despite harm using the substance, then we conclude that you have the disease.
Okay,
it must be in the mildest form, that you have only about 2 or 3 of the symptoms. There are usually 11 symptoms. If you have 2 or 3, it's a mild. You can have 4 or 5, which is a moderate symptom. 6 or more means you have severe. Based on how severe the condition is, we may recommend a residential rehab, or sometimes you can do what we call brief intervention.
Okay.
We advise you and help you. Not everybody has to be in a rehab. So based on how severe it is.
Okay.
But by the time you get to severe, you need a residential rehab.
Okay.
Which should be in every region. So I'm happy he's doing it up north.
Okay. Just a little clarification, and I'll go back to Roger. Are you saying that if you're going to hang out, say on Friday, you should think about how many bottles you're going to consume before you go and have a sit down?
Well, that is what everybody does. I mean, nobody goes to the restaurant to say, if I go and I can eat 5 plates, I'm going to eat like 5 plates of food.
Yeah, but this is alcohol we're talking about. Do you pre-plan how many bottles?
No, listen. So what I mean is that you go to the restaurant knowing that you are going to eat 1 plate of food. You don't go and say, if I go and there are 5 plates of food, I will eat all. So going to the drinking spot on Friday, you have an idea, I'll drink a bottle or 2. If you end up drinking 5 or 6, you definitely have a problem, because you intend. And don't forget that people who drink know, for instance, they'll drive after drinking. So they know very well that if I drink more than 2 bottles, I can't drive safely. But when you start drinking, you forget about all those safety precautions. Then you suddenly begin that, even after 4, I can drive. After 5, I can drive. So once you get that impaired thinking,
Hello, Dr. Dodoy? Okay, I think our connection to Dr. Dodoy is frozen, but I still have Roger. Dr. Dodoy will join us when the connection is a bit stable. Roger, so what kind of people do you see? I know that Albert said, you have some 5 active clients right now, but you've seen about 29, close to 30 so far. What kind of situation do they present with?
Currently, we have about 8 clients here.
Oh, okay.
But we have, that's the current number. We have about 8. We not only looking at the alcoholics alone, we're also looking at the other substance abusers or other addicts as well, because we are collaborating with other institutions. We're working with a team that has to do with the psychiatric team and the medical team as well. So we're not concentrated on alcohol alone or the alcoholics alone. And addiction has no respect for profession or tribe or religion. We receive all sorts of people here, professionals. I don't want to mention any profession, so people would misinterpret what I'm saying. But we receive all sorts of people here. We receive calls, complaints from family. Students these days is the worst hit. I always say that if we don't do something, before we wake up one day, we'll all we just sit on a time bomb. Let me put it that way. The did a survey recently, and the report is alarming. It's alarming. The number of students that are smoking marijuana, the number of ladies that are using pain relievers, that's the tramadol, and they had pain killers. So it's just a serious problem that we as a country, we need to start thinking seriously about it, what to do to educate the youth. I went into addiction, I can say, I just by ignorance. I didn't know anything known as addiction. So just like what I did, or what led us to starting alcohol and graduating to other substances, the youth doing the same thing. You go to schools and you educate them and want to know more. What are we doing about that? Can't we make it part of our educational system that some of us will be allowed to go around and talk to them? So we receive all sort of people here with a lot of problems. Those that come here, majority of them are professionals and cannot even go to work. Cannot go to work.
Do you have a situation where some come and then they recover and they go and they come back again?
We those that are not willing yet, you should be ready. You should be ready. You get to a stage that you realize that the addict is ready for recovery, is ready for rehabilitation. With them, you are able to handle them. The other problem that we are faced with is a resource. Family members are not able to keep the person there because of financial constraint. So they abort the program. They don't usually complete the program here.
Okay.
When that is done, the person is not properly rehabilitated, and definitely, like doctor said, what we don't want to say relapse, would go back to the drinking. So yes, we have instances that people come here, leave, and they bring them back, or we hear that they perhaps are not doing well, and all points to the fact that they were not able to complete the program.
So typically, how long would it take for a person to be well?
That all depends on the person's the system. Every individual and the way his system works, the willingness or the readiness level of the person also counts. If the person is ready for it, it's not that difficult to rehabilitate such a fellow. All you need to do is to try to guide him, change his mindset, the way he feels about himself, try to get to let him understand that he's born with a purpose and that he's not just here to drink alcohol and leave. So it depends on the individual, but I will always say a minimum of 3 months, a maximum of 12 months. But some of them comes in with a lot of withdrawal symptoms. It takes a long period before you're able to even put them out of a support drug to manage their withdrawal. So it takes a longer period to get the person ready for society again.
Roger, what was the turning point for you? And I'm asking, this is your own personal situation. What brought about the change?
I met Dr. Sego, and he's a professional. The first time somebody was able to let me believe that I'm born with a lot of purpose. I'm here for a particular task on earth, for a particular task, and I needed to do more than I'm doing. Alcohol is not my destiny, and I needed to come back and get back to school and be productive and contribute towards the development of the country and my family. So doctor gave me a lot of hope. Doctor made me understand that I should fight and come back and be a better person than being called an addict or an alcoholic. So it's the hope, it is the guidance that they will give you, and it's making you, if you also understand the principles and live by the principle, before you know you're out of it and you are doing well. It's the hope that doctor gave me, the self-belief that doctor is telling me. It made me now. When I came up from recovery, my behavior, my everything changed. The way I see myself, the way I want to know, the way I want to do things, everything changed. So it's the person that you are going to meet. If you meet the right person, the right professional, the right environment, you'll be able to come back.
Yeah, but you know, a lot of things changed about you, except that the bars, the sports, they kept increasing. So what happened when you spotted these bars?
That is one of the biggest problems. Every 100 meters in my community, I think you get a drinking spot. Not even the established drinking spot, but various homes are now turned into drinking spots. Compound houses. In the middle of the compound house, a room is selling alcohol. My biggest problem, Doc, and everyone listen to me, is siting drinking spot closer to senior high schools and junior high schools. That is my biggest problem now. And they are everywhere. They're everywhere.
So how much does it typically cost to treat one person for the entire duration?
Well, if you are doing residential, it's very expensive because the person will have a room to himself or herself. We still need to respect their privacy, and you'll be feeding the person morning, afternoon, evening. A lot of things that you invite other team members, volunteers to come help you, like the psychiatric part of it. We need to invite or call the psychiatric department. We have other medical aspects that come to support that. It's very expensive to rehabilitate somebody. You would need up to 15,000 to rehabilitate the person, depending on the duration of his stay in the rehab.
Okay. And do those that come through, do they all have the money?
Come again?
Those that come through your facility, do they all have the money?
That is the problem. That is the problem. This place should have been occupied, or if they say full to capacity by now, but because of the money issue. People come here, do the process, you give them the bill, and they say they cannot afford the bill. Every day we meet them, people call. When you tell them the bill, they tend to say they cannot do it.
Yeah.
And most of them are even a threat to their family now, threatening to kill those that are on all hard substance, and they don't even know how to handle them.
Yeah. I'll bring Dr. Dodoi in to find out if there's any other intervention that is free, if you like. But you watching and listening out there, if this is a condition that you have and you want to speak to us, please feel free and give us a call now. 0302 211 69102. 0302 211 69102. I think we can spend about 5 minutes picking phone calls on this subject. Dr. Dodoi, is there a way that somebody can be rehabilitated free of charge?
It is a double-edged sword in the sense that when you have an additional mental health symptom or mental illness in addition to the drug addiction, then 3 psychiatric hospitals and maybe others psychiatric units in the country provide free mental health care. But that is to the mental illness associated with your drug abuse. If it's just a pure addiction, then currently there is no free health care. It's not covered by health insurance. It's only some few organizations that are prepared to sponsor their employees go through rehabilitation. And I'm proud to say that my University of Health and Allied Sciences, has sponsored a few people who have come back to work and they are working. The teaching hospital too has sponsored some employees who have gone into rehab and they are back working. So sometimes the organization can help. It's a policy we call Employee Assistance Program that, in fact, all organizations should have to help persons with addiction. But people who do not have anybody, should I say, spending on them, then as Roger said, it's very expensive.
Okay.
And
Sorry, I just want to pick some calls. Rashid has been holding on for a while now. Rashid is joining us from New Ebrim. Good morning, Rashid. Thanks for holding. Let's hear you.
Good morning, Mama.
Yes, sir. You're good?
Yeah, I'm good.
Okay, great. Talk to us.
Yeah, what you guys are discussing this morning, I'm really enjoying it. Personally, I'm a victim, you know.
Okay. When you say you're a victim, are you out of it? Is it alcohol?
Well, I smoke.
Okay.
I also take alcohol. Not every day.
Is it a condition that you want to get out of?
Yes, please.
Okay. Have you identified what drives you into it?
Actually, when I'm ideal, when I'm not doing anything, assuming some of us, the youth, when we are busy, we don't go to the ghetto. We have a word doing, what the hell are you going to do at the ghetto? See, when all of you are just inside watching telly, sometimes when you go out, it drives you there. How much is weed? I must be honest. So
Okay.
sometimes the problem is the work that we are not doing, and then I personally, right now, I face a lot of, let me see, I don't care, let me put it that way. So this program, I've gotten something out of it. I just want to call and say thank you.
Oh, thank you, Rashid. Thank you very much. Stephen is in Koforidua. Good morning, Stephen.
Yeah, good morning, Mama.
Yes.
Thank you so much for your program. Yeah, hello.
Yes, Stephen. Oh, Stephen, I can hear you. Please go ahead.
Oh, okay, I'm even calling from Koforidua, Old State Junction.
Okay, great.
Yeah, I'm live watching your program. And you guys are doing very, very well. I love the education that you people are doing now. And I would say congratulations to you guys.
All right. Thank you very much.
Continue to bless you. And then I want to ask that we can even put a number down so that we can get back to the guy who went to the same situation. So that our friends and family also can learn about it.
Okay. All right. Sure.
Thank you so much. God bless you.
Thank you, Aben. Aziz is in Cape Coast. Hello, Aziz. Good morning.
Good morning.
Yes, Aziz.
Yeah, please, I want to contribute to what the guy Roger was saying.
Please do.
Yeah, you see, good morning.
Good morning, Aziz. We can hear you, so go ahead, okay?
The Roger point, the guy was making a lot of fighter points. You see some of the hospitals, psychiatric hospital were... Okay. He's talking about the Dr. Sego. If you look at the Roger program right now, the drug is not the one who killed Roger, but it was the message that the psychologist doctor is giving to Roger. That is what it killed him. Some of the psychiatric places we have in the country, there's no psychology doctor.
Do you have a personal experience, Aziz?
Yeah, exactly. You see, the doctor is the one who still let me in this country. When I came to this country.
Hello, Aziz?
Yes, I smoke. Hello.
Okay,
Hello?
Can you say that again? I missed what you said.
Hello. I said I don't smoke. I don't smoke. I don't drink. Hello? Hello?
Okay, I'm afraid, Aziz, we have to let you go. Please turn down the volume on your television set. Otherwise, we will have very uncomfortable feedback and we can have a smooth conversation. Thomas in Kumasi, I hope that your volume is down so we can speak through the phone.
My volume is down.
Okay, great. Good morning. Very clearly, I can hear you. I hope you're well.
Good morning to the doctor and the gentleman over there. I will not call him guy. He is a gentleman. And I tell him, yes, I was wanting to re-smoking, okay? Way back 97, after completion of secondary education. And I went through this re-smoking for about 5 years. But there was a program on the internet that is iDelete.com. There, they help us to quit alcohol and smoking, which really helped me to quit from smoking. But as Dr. the gentleman said, it's not easy when you quit because the feeling is still there. So at times you'll be to go back unless you change your mind that you will not go back. That's what I call determination. It's very important when you want to stop alcohol and re-smoking and others. Thank you.
Well, thank you. Congratulations to you, Thomas. Thank you for sharing. That's Thomas in Kumasi. I think our last caller will be Tony in Mankasim. Good morning, Tony.
Good morning.
Yes, Tony, thank you for reaching out. Talk to us.
Oh, I want to smoke excessive smoking of cigarettes.
Okay.
So, if I may link to go to the internet, so that I can.
When you say excessive, how many sticks can you take in a day?
As much as I can get.
Oh, is it?
As much as I can get.
Okay. What makes you smoke?
Oh, but I think should I say I'm addicted to it? Because I can't concentrate if I can't get.
Okay. But you've got do you have regular work?
Oh, yes, please.
Okay, so you excuse yourself to smoke sometimes?
Okay, when I'm at work, I don't smoke. But as soon as I get home, then it will flow.
Okay. So what do you want? Do you want to stop? Do you want to reduce it?
I actually want to stop.
You want to stop? Great. Okay. So just to give your contact number to my producer, hang on and give your contact number to my producer. We'll link up with you so we can connect you to Dr. Eugene Dodoy. Well, that's all the calls we can take, unfortunately. We'll see if we can leave some numbers behind. Dr. Dodoy, how important is somebody identifying that this is my problem, this is a condition that I have, but I want to stop? How important is that step?
So it's about the most difficult step to realize that you have a problem. So like I said, it's the first step in the 12 steps. So usually when they have the problem, they are always in denial, and that is a symptom of condition that they don't realize they have lost control over the drug use. And that is where we have a challenge. So it is have lost control, and we should all make an input to help these people, whether we are the employer, we are the family member, we are the friend, or we should engage and help them get support than to claim that they know what they are doing. So we leave them to make a determination when they have suffered probably an irreparable consequence of their addiction. So we should help them before they get there. And it's very important we don't blame them as if it is a moral failing. It's a disease of the brain that we know people are born to have it. So it is just like hypertension and diabetes. People who are born to get it will get it, and we only can help them through it, and we can't do much about it. So it's very important we don't stigmatize, we don't accuse them, and just treat them like we treat somebody with a sickle cell disease or hypertension or diabetes.
Great.
And I think as a nation, we come to that realization where the West has come into that addiction is a disease. Let's help and treat these people, and possibly help them with insurance as well. Okay,
great. Is there a contact number? Is there a number that people can call and get help?
Yes, usually the Mental Health Authority puts out contacts, and Narcotic Control Commission is also, a regulator of that space. They provide these services. There are services in Accra. We have House of Hopeful Way Foundation in Oya. We have Welling Way Foundation in Kumasi. Then now we have one up north. We are opening one in Takoradi, I understand. So at all the 3 psychiatric hospitals, Accra Psychiatric Hospital, Pantine Hospital, and Anchor Psychiatric Hospital all have rehabilitation centers in their facilities. Okay, so people can get help and in all of them. In fact, Narcotic Control Commission has got plans to establish a rehab in every region. And that is the way to go.
Okay.
We've not to see it materialize. So
all right.
Individuals who are helping like Roger, need to be supported. When I traveled west in the US, in fact, we get churches and group organizations coming to cook for people in recovery, knowing very well that, they are fighting a disease they can't fight alone. And let's not forget, when people are addicted, it affects the whole society. They become counterproductive. They steal from us because they need to maintain their addiction. So they are not working. That's when they engage in robbery and stuff like that. So it is actually in our interest to support them financially, cook food for them. Churches can go to La Roja's place, give them food, donate food to them, to Lydia's place in Kumasi, Willing Way. Donate food to them, help them so that they can take care of the other people who can't afford. Because many people are addicted, they want to quit, they can't afford rehabilitation, they stay sick, and they only have to commit crime to stay addicted, to stay sick. It's quite unfortunate, and you get a vicious cycle.
Yeah.
So any individuals can do. The mental health authority is there.
Okay.
And all of us are around to help.
Okay, great. I'll come to you, Roger, but I think I got some, maybe 3 more minutes to pick some more calls. So if you're watching and you still want to reach out, 0302-211-69102, 0302-211-69102. You can reach out right now. Give us a call now on this conversation. So, Roger, what kind of support would you require? What are your immediate needs?
Oh, thank you so much. All we need money to furnish the place very well, to get a few motorbikes, if you like, to support the work here and provide food. If we even have a foundation that is providing the money for already to rehabilitate people, we can find the people to bring them into rehab. Every day they walk in here and they can afford to pay for their bills. So all we need is money to establish well and get the right professionals to support those coming out. If we want us to put our number there, out there, we can also put our number out there for people who want to contact us and have a partnership or discussing with us.
All right, I will come to the number. Let me speak to Ahmed. Ahmed is in Sisala West. Good morning, Ahmed.
Hello, good morning.
Yes, good morning, Ahmed. We can hear you. Go ahead.
Yeah, I'm happy seeing and watching this morning. In fact, may our experts live long to always help rebuild society. May Roger also continue to do his good work. May Allah help him. In the sense that, you see, we have a big problem or bigger problem in our society. Hello?
Yes, Ahmed, we are listening.
Our biggest problem is always start from the house. Sometimes start from the house. I've seen parents smoking with their own children. I've seen them. And there was this time I met a man with 3 of his children. They were smoking weed together. And you hear him saying, Charlie, make you pass me. I've seen women who has given money to their children to buy alcohol and cigarette before they go to farm. And so what do they also do? What would they do to help these people? It's about going to the communities. You see, if we wait for them to come to rehabilitation centers, how many of them even have the mindset that this is the place I have to go? The more you even go to mention it, they are not ready to do it. But when you organize community education forum programs, it will in a way help these people.
Okay. All right.
Yes.
Ahmed, thank you very much for sharing your thought. Ramatu is an Adenta. Good morning, Ramatu. Hello, Ramatu, are you there? Okay, unfortunately, I think I lost you there, Ramatu. Roger, you can go ahead and put the number out.
Can get us on 024 2275 818. 024 2275 75818 or 05091253886. 05091253886.
Okay.
If you give us a call, we have a further.
All right, great. Let me speak to Isaac. Isaac is in Takoradi. Good morning, Isaac.
Hey, please, how are you?
Oh, very well, thank you. How are you?
I'm really enjoying this program. I'm great.
Good.
The man mentioned one Dr. Segu.
Yeah.
Good morning.
Isaac, please turn down the volume on your television set, okay? Let's speak using the phone.
Okay. Is it okay now?
Yes, it is. Go ahead.
Yeah. I'm very happy to see this program on your TV this morning, and I'm very so happy. The man mentioned one Dr. Segu. And if I tell you what Dr. Segu has done for my daughter, it's not only about black people, it's also about children with autistic challenges, hyperactiveness, and my daughter has made tremendous progress. So I just want to thank you people for hosting this program. It's nice, and I encourage all of you to continue to do this.
Okay, what is Dr. Segu's first name, though?
Yeah, Dr. Segu certainly asked me to do certain physical therapies, like teaching her how to brush her teeth, wipe her backside, walk with her to the restaurant. And it's not only about drugs. I mean... I get it.
I wanted his full name, but if we can't get it, I'll find it. I wanted Dr. Segu's full name, but I'll find it. Thank you, Isaac. Let's speak to Divine. Divine is in Aflao. Good morning, Divine.
Yeah, good morning, Mama B.
Yes,
Thanks so
Divine.
much to you and JoyNews for the good work you are doing.
Thank you for sticking with us.
Yes, I want to add my voice. I am a former student of chapter that you are currently hosting. I just want to say that mental health problems will worsen after this pandemic. And if we do not work as a people to end alcohol and drug abuse now, we would have a ripple effect after the COVID-19. The team working on the rehabilitation of these people, there is one thing that we are losing focus on, and that is health workers abusing some drugs because, one, they are closer to these drugs, and they are not living in limelight. So the focus will also be on the health workers and what we can do as Ghanaians to help even people who are on the street. There are others on the street who suffer this drug abuse. They stand in front of that water seller just looking at you. What will it take from you if you give him some of the water? What will it take from you as a Ghanaian to just buy 2 cedi of the water that you are coming to buy just to help him have his daily bread that morning? So let's continue to destigmatize these people. Let us not treat them as, one of those people. Let's treat mental health issues as just like we treat sickle cell, hypertension, and diabetes. And I'm sure that together we can end alcohol and drug abuse. Thank you very much, Mama.
Thank you, Divine. My last caller, Victoria is in Kumasi. Good morning, Victoria.
Good morning. Please, thank you so much for the program you are hosting. I want to thank Lord Ghana, Volga Branch. Yes, they've done so much for one of our mates. Back in secondary school, Navrongo Secondary School, were mates in 1998. And he has stayed there for just over a month. And when they sent us a picture of him, we could see great improvement in him. We want to thank them so much for the work they are doing and that they should keep it up. My regards to our mate there.
Okay.
If I'm at liberty to mention his name, our regards to him. He's now doing very, very well. We want to thank them so much. Gradually, he's coming out of it. And when we saw the pictures, how he was and how he is now, God bless them.
All right, Victoria. Well, thank you very much for showing your appreciation as well to Roger and his team. Victoria in Kumasi, summing up really as we wrap up. Roger, so Victoria is thanking you for the work that you did for a friend, who's gradually coming out. Unfortunately, Roger is not on, but thank you very much, Roger, for what you do in Bolgatanga. Thanks to Albert Sori, our Upper East Regional Correspondent, for telling us the backstory. Thank you, Dr. Eugene Dodoy, as well, for the education, for the insight as well. Well, we thank you for watching our show. It's a wrap. We will see you Wednesday morning, God willing, at 6 a.m. Please don't be late.